weekly mental health check-in. This week, we're looking at the fear of going out in public and how much of it can be tied to the COVID pandemic.
Plus, if you've ever felt overwhelmed during an argument with your significant other, you might have experienced emotional flooding. We have more on what flooding is and how to manage it. Let's bring in Dr. Erica Richards for more on these headlines. She's the chair of psychiatry at Sibley Memorial Hospital and an assistant professor of psychiatry at Johns Hopkins Medicine. Dr. Richard, good morning. Thank you for being here. So let's start with anxiety and COVID. Many people experience fear of going out to public spaces because of COVID and the long-term isolation it's caused. And some are concerned that it could be developing into agoraphobia, So walk us through how to tell the difference here between a short-term anxiety and a full-blown diagnosis. What are some tips, too, for dealing with it?
Good morning. So agoraphobia, defined by the Diagnostic and Statistical Manual of Mental Disorders, or DSM as we call it, is essentially an instance where someone has a fear of going into public spaces. It's listed as an anxiety disorder. Why is this important? Because people that still have a fear of going to the grocery store, for example, may fit the category of anxiety disorders, but not necessarily agoraphobia. What can we do about that? This is a disproportionate fear of going to public spaces. So overall, mental health professionals are hearing the word COVID, yes, but still fears about being out in public. The best answer is what to do is to start slow. Maybe you're not ready to go for a full-on grocery shop, but 15 minutes, 20 minutes, picking up key essentials is where to start, and then move forward from there to ease back into this public space that you're going to.
Easing in, some good advice there. Let's talk about that other thing we mentioned, arguments in relationships. Most people will say they've experienced a bad fight in a relationship at least once, but in some cases it leads to something we mentioned called emotional flooding. So what exactly does that look like? Is there anything we can do to really better handle difficult emotions during arguments, during those hard times?
Emotional flooding. This is the psychological and physiological overwhelm that people experience during conflict. Why does this happen? Well, it's part of our fight or flight response. Inherent in our bodies, the release of hormones, adrenaline, cortisol, which trigger us to defend ourselves. Now, historically, this literally was to save our lives, but when we feel emotional threat, this happens as well. And so now that we know that this is a normal physiologic response that our body has, sweating, chest palpitations, feeling your heart rate increase, what do we do about it? Step back. Experts say take at least 20 minutes, gather your thoughts. Don't say anything kind of abrupt that you might regret later. If you need more than 20 minutes, take more time, but not more than 24 hours. Come back and have a discussion knowing that you may not resolve the issue, but at least you're protecting the relationship and able to communicate more effectively after you've taken this time.
Sounds like so much of what you're saying is go slow, go steady. And I wanted to also ask you about boredom. Experts are saying that boredom could be considered a warning sign from your brain. Can you tell us a bit more about that and what we can learn from it?
Such an interesting article. This is from the Washington Post, and essentially they equate, the authors equate boredom to pain. What is our pain response? We touch something hot. Our body sends a signal to our nervous system. We remove our hand from what's hot. They signal boredom as something that's very similar. Now, important to remember that boredom is different than relaxation. Boredom is when our body wants to be engaged, but we can't. What can we do about that? What matters is what you have at your disposal to fill that time. You don't want to get into spending too much time on social media, get into other kind of things that are not productive. Then have a hobby, have a book that's ready. Figure out what you can do with your time to more effectively cure ourselves from that boredom.
Dr. Erica Richards, keeping us healthy and well. Thank you very much.
Only you could just bring a puzzle with you everywhere.
I know.
That would be hard. So, all right, coming up.